Hi, everyone. My name is Kessa Sobolewski. I am a counseling intern for substance abuse and mental health at Quest Counseling. I put this presentation together with my colleague Esmeralda Diaz with the intention of sharing information about the effects of cannabis on pregnancy. So the intention of this is just to share information so that you have it at your disposal should you or your partner become pregnant, or if you become pregnant, so that you understand more, because there's a lot of information out there. So hopefully this will help guide you along a little bit and provide kind of an entry into things to think about. So I'm going to dive right in because first I'm going to kind of talk about some of the different terms when it comes to cannabis, marijuana, THC, just to help promote some understanding about the different terms that are out there. So starting here, what are the main differences between cannabis, marijuana, hemp, THC, and CBD? There's a lot of terms out there. Primarily, cannabis is going to be a more generic term. It's going to refer to the plant that contains biologically active compounds. CBD and THC are some of them, and that are found in the cannabis plant. CBD is often referred to as the anti-inflammatory agent, but often CBD products do contain low levels of THC, and THC is actually the compound that is known to get you high if you use or ingest or smoke marijuana. And then marijuana is a type of cannabis plant, so it can contain varying levels of CBD and THC compounds. It depends on the plant. It can vary plant to plant. And then finally, hemp is a type of cannabis plant, and it typically contains CBD but low levels of THC. Again, that can vary depending on the plant. I think it's important to note that a lot of products out there may or may not contain the same levels that they claim to. There's a lot of products that are not as regulated as they may claim. So especially when it comes to your use and pregnancy, it's important to be aware that that is definitely a risk factor to be aware of. So marijuana has been found to be the most commonly used illicit drug during pregnancy for women. And actually they're finding that that number is going up. So in 2019, the National Survey on Drug Use and Health did a study that found that cannabis use more than doubled among pregnant women from 2002 until 2017. And that study was conducted with nearly 500,000 women ages 12 to 44. And those were that information was generated by self-reports. In 2017, a separate study found that 20% of women aged 24 or younger screened positive for marijuana. And this study found that women were more than twice as likely to test positive for marijuana in drug tests versus self-reported measures. And so what that might suggest is that that 2019 study that I just mentioned may actually be underreporting. So it may be much more than, those numbers might have increased much more than doubled. So I'm gonna stop sharing here. So what has led to this increase in use? I think probably a big factor has been the legalization of recreational marijuana for many states. That has led to some misinformation that because it's legal, it means it's safe. Marijuana is often seen as a natural product. It's often marketed to treat health conditions that are especially prevalent during pregnancy, such as nausea, chronic pain, muscle spasms, and mental health conditions such as anxiety and depression. Furthermore, another study found that non-medical personnel who work at dispensaries were often recommending the use of marijuana for pregnant women who are experiencing nausea, which does go against what medical personnel and these studies are finding. So it's important to note that the FDA warns that there are serious risks of the use of cannabis products for pregnant or breastfeeding women. And we'll talk about some of those here. I'll share some slides with you. So In addition to risks during pregnancy, marijuana also it affects our hormones, and so it can affect a woman's ability to get pregnant as well as interrupt her menstrual cycle. And it has also been found to result in a reduced sperm count for men. Um, when we do become pregnant, then we found that THC can cross the placenta, and so there has been a strong concern that this may impact fetal brain development. It's also been correlated with a low birth weight for babies, so that means less than 5.5 pounds, anemia, and encephaly, which is a condition that affects the brain and spine, and it can result in babies that are born with missing parts of their brain, skull, and scalp. And there's also been found to be 2.3 times greater risk of stillbirth. The strongest and most consistent finding is that women who use marijuana during pregnancy were significantly more likely to deliver before 37 weeks of gestation. And so that would be a premature birth compared to women who did not use marijuana. There have also been risks associated after the baby's been born. Some babies who have been exposed to marijuana during pregnancy have gone through withdrawal symptoms once they're born. So they may experience tremors or cry for long periods of time. They may experience problems with sleeping, problems with behavior, memory, learning, problem solving, paying attention, and it's also been correlated with depression. Women who use marijuana while breastfeeding, because THC can be passed through breast milk, as I mentioned, it's fat soluble. This affects the infant's brain development, and it can also affect the amount and quality of breast milk you produce, which is likely related to the way it impacts our hormones. So I think it's important to also feel comfortable talking to your doctor about your health needs and concerns. The main takeaway is that there's no safe amount of marijuana to use while pregnant, but there are other medication options out there that are safe that can help address your physical and mental health needs. Sometimes things like diabetes or nausea or depression, maybe something you've experienced even before or developed while you're pregnant, but there are medications that are safe and that can treat that. So to be able to talk to your doctor about it. Many women take medication while pregnant, but it's important to make sure that you're taking the right ones that will be safe and that are gonna keep you and your baby healthy. Thank you for your time and attention. I hope that this was beneficial. I realize that there's so much more to learn, but hopefully this gave you a little bit of information about what the research is saying about cannabis use in pregnancy. If you or someone you know is in need of support, there are confidential and free hotlines available, as well as that can direct you to local resources. One good one is SAMHSA. Their national helpline is 1-800-662-HELP. Again, that's 1-800-662-HELP. And they can help direct you to resources and provide support for those who are maybe experiencing mental health or substance abuse issues. So thank you again, and I wish you well.